So a lot of my patients ask me about different IOL options or lens options for cataract surgery. In my professional opinion, there are three important things to consider when choosing an intraocular lens. Hi, my name is Amy Cadis. I am a board-certified ophthalmologist. I practice a little outside of Nashville, Tennessee. Cataract surgery is one of the most common procedures that I perform. When you have cataract surgery done, the cataract, or the lens in your eye that has become cloudy with time, is removed and a new lens implant is placed at that time. When choosing a lens implant, we have to think about whether you want a monofocal implant, an implant that has one focal point, or a multifocal lens implant, one that has multiple focal points to help you see in the distance, intermediate, and near. Here are three things that you should consider when thinking about whether you should get multifocal lens implant and to see whether it is worth it for you. The challenging thing about choosing a lens implant is that sometimes these lens implants are covered by insurance and sometimes they're not. And when you're choosing a multifocal lens implant, you have to decide whether the cost is worth it for you. Here are the three things that I tell my patients to consider. So number one is convenience. In my patient population, they are often people who are retired and wanting to enjoy life, wanting to get out and about and not have to think about glasses and having different glasses for distance, rating, or intermediate work. I often tell my patients that when I put in a multifocal lens implant, I want them to have the ability to drive without glasses and go to a restaurant, read a menu without glasses, and just do their everyday activities without glasses. Not having to think about glasses for different activities is very convenient for my patients. So sometimes I even have patients who talk about how they have different pairs of readers all over the house, all over in their purses and in their cars, and having multiple glasses and possibly losing them, and the cost of reacquiring more glasses can often add up. And it's annoying. So if you're looking for glasses-free convenience, you should really consider getting a multifocal lens implant. Number two is cost. The cost of progressives really add up. People can spend upwards of $600 to more than $1,000 on progressive lenses year after year. When choosing which IOL you want at the time of cataract surgery, you should consider the cost of glasses even after the procedure. Getting a multifocal may save you money in the long run if you're not having to buy progressives year after year. The average cost of a multifocal lens implant could vary between $3,000 to $5,000 depending on which region you live in. You have to consider the fact that progressive lenses, purchasing them year after year, could add up to even more than the cost of that multifocal lens implant. When you're choosing a lens for cataract surgery, it's also important to consider safety and lifestyle. With progressive lenses, there is an increased risk of falls, especially if you're not looking through the correct portion of your progressive lenses. Also, your peripheral vision can be blurry when looking through progressive lenses. These two factors can impair your lifestyle and create a safety concern when walking or climbing stairs. Also, if you have a lifestyle that's extremely active, if you're playing sports, glasses can be intrusive and get in the way. They can also fall and break. And so those are things that you should consider when choosing a lens implant. Lens implants for cataract surgery are not one size fits all. There are some patients that would not do well with a multifocal lens implant, such as if you have advanced macular degeneration or glaucoma. So it's very important to speak with your doctor to know if you are a candidate for a multifocal lens implant. But if you are, you may consider these three things to see that the cost may be worth it for you. In cataract surgery, we want you to make a good and well-informed decision when it comes to choosing your lens implant, because we hope that this lens implant stays there for the rest of your life. So if you're unhappy, having a lens exchange is a difficult procedure, so we want to get it right the first time. I hope you found this helpful. What questions or comments do you have about cataract surgery? Just drop it in the comments below.